So we're meeting now to talk about laparoscopy and try to help you understand what our plans are and to help you understand what's involved in this procedure. So an operative laparoscopy means that we can do a surgical procedure to look inside your abdomen for a number of different reasons. Commonly it can be done to look for conditions that can cause pain, such as endometriosis, or it can also be done to remove cysts or growths involving the ovary or the fallopian tube. We're going to discuss the surgery in general and go through the information, including the risks and the benefits of an operation. A laparoscopy is day surgery. It means you come in the morning or in the afternoon and go home the same day. You don't have to sleep in the hospital. The surgery typically at Boston Children's Hospital is done on a Wednesday, and thus the night before you can't eat or drink anything after midnight. That means no gum, no lifesavers, no water. You can brush your teeth, but you can't swallow water. The surgery is done with you sleeping. So you're under general anesthesia to have the procedure performed. We do things a bit differently at Boston Children's Hospital than we do in the adult world. So if you watch a YouTube video on laparoscopy, it's going to look a little bit different. We do not use vaginal instruments during a laparoscopic procedure at Boston Children's Hospital, and you'll be lying flat during the procedure with nothing inside the vagina. We do insert a catheter, a small rubber tube, into your pee hole once you're sleeping, and we remove it before you wake up. The laparoscopy, as I mentioned, is done while you're sleeping. The way that we do it is with fiber optic telescopes. Fiber optic telescopes are small tubes where we can make small incisions on your belly to look inside. Typically, we make a 5-millimeter cut, which is quite small, in your belly button, so the scar is hidden within the belly button so the scar doesn't show. The secondary sites where we have to put in are other small marks where we put other instruments to do the surgery are down by the pubic hair region, which is different than a lot of adult gynecologists do. We keep our scars low so that if you wear a two-piece bathing suit, we're not telling you what kind of bathing suit to wear, but if you wear a two-piece bathing suit, the scars don't show. The incisions do heal themselves and the stitches do dissolve themselves. So we've created an informational guide for you which looks like this kind of book, but it's available for you on your phone or on a computer, and we can keep it updated for you. The book shows you many of the people that you're going to meet when you come to the hospital. It has an important checklist of things to do before the surgical procedure, so you do want to read through this book before the surgery. It also shows you people who are involved, who you'll meet in the operating room, in the recovery room, which is where you go after the surgery, and then when you're ready to go home. Let's talk a little bit about the specifics of the surgical procedure. So whenever a surgeon operates on someone, and I will be one of your surgeons, or one of my partners will be your surgeon, depending on who is performing your surgery, there is usually a surgeon with an assistant, and there are 2 nurses in the room and 2 anesthesiologists. We're all there for your safety. We keep you covered for you to maintain your modesty and to maintain the fact that no one can see your body except for the part of the body that we're operating on, which is the middle of your belly. During the operation, we're going to look inside, and if it's being done for treating pelvic pain or endometriosis, we'll look for the disease and then either cut it out or destroy the disease. There is no cure for endometriosis using surgery, so it's important to remember that the disease can grow back afterwards, and we need to use medications to keep it from growing back. If you're having a laparoscopy for an ovarian cyst or a cyst near the fallopian tube, then it's also important to remember that those kind of cysts can grow back in the future. It's not that the one we take out grows back, it's that a new one could form in the future, and so that's important to realize. Whenever we do a surgical procedure for someone, we do have a consent form that we sign. The consent forms gives us permission to operate on you. Even if you're not 18 years of age, we do ask you to read through this and sign the consent form along with your legal guardian. The reason we do that is no one has the right to touch your body without your permission, and so we ask you to read through this and sign the consent form. The consent form goes through the risks and the benefits of a surgical procedure. It's important to know that whatever a surgeon does frequently or a lot of a similar operation, It decreases your risk for that operation. It's no different than any other activity that any of us do, whether it's a sports activity or different kinds of academic activity. The more that you do, the better you get. So if a surgeon does a lot of a procedure, it decreases your risk of the procedure. I will say for myself, I do between 6 and 10 laparoscopies a week, and that's a lot for young women, and probably do more laparoscopies than most gynecologists in this country in this age group. And that decreases your risk. The specific risk for a laparoscopic procedure, as we mentioned in our consent form, is the risk of damage to your bowels, your bladder, your blood vessels, or nerves. That risk is decreased based on the fact that we do these procedures frequently. The most important risk that you need to realize is that there isn't a cure for endometriosis, as I mentioned earlier, and that ovarian or fallopian tube cysts can grow back. The rest of the consent form is generic, and you will be reading through that and signing the consent form and putting a date on the consent form. Please feel free to remember to ask any questions that you have regarding surgery. Anytime you're having an operation, people can be nervous, and that's normal. We're here for you to answer your questions. Our whole staff is available to you. Remember, you're not a gynecologist and you don't know what's going on with a procedure in great detail, so no question is silly, and it's important to ask all the questions that you have. We're hoping that this video is helpful for you in understanding the surgical procedure.